If this is your first OkMoM, we appreciate your service. If you've been in every OkMoM, we again thank you for coming back. The purpose of the surgical section is to provide as much surgical care as we can to as many patients. We want to try to limit the care to about 45 minutes and take care of things that are giving the patients pain and suffering. It is not our intent to remove 4/3 molars or do treatment like that, because we want to treat as many patients as we can during the one reason why we don't do extensive surgery is we really have no follow-up for these patients unless they have problems, and that we just have to call a dentist in the area, ask them to see the patient. And as far as prescriptions, we usually don't use narcotics. We use over-the-counter ibuprofen, Tylenol type things. And so we really want to try to limit our care to what is really symptomatic. We normally have more volunteers than we do dental chairs. And so we will ask you to see 2 or 3 patients, and we'd like you to take a break and let others rotate through. We need to have extras because we might have bad weather. People plan on coming to help us and then decide that something comes up and they can't make it. So please be patient. We know everybody wants to work and do as much as they can, but if one of the leads asks you to take a break, or just, we'd like you to do it on your own just after 2 or 3 patients to take a short break. Go to the hospitality room, they've got snacks, visit with other colleagues and friends, and then come on back and work. Safety is one of our main issues. We want to be safe for the patients and for ourselves. Last year we had no needle sticks, but the year before we had a few needle sticks, so we asked you to use the needle protectors or one-hand technique so we don't have needle sticks. If there is a needle stick, let one of the leads know so we can do the needle stick protocol. We want you to remove all your sharps prior to taking your instruments to sterilization. We will have sharps containers in the surgical area for you to use. We don't want our patients to wrap their lips around the suction. Hepatitis B and other things, we have some suction, but it's not the greatest suction, and if a patient sucked hard enough, they could get some backwash from the suction. When you see the patients, they will already be triaged, but that does not mean that the triage dentist makes the final decision on what treatment is done. The treatment will be determined by the treating dentist. When you examine the patient, you'll determine what treatment you're going to do. Then you go to sterilization, and they'll give you your instruments in a cardboard boat. And please just get the only instruments that you use. At the end of days, in previous OkMoms, we find enough instruments you could almost equip a hospital with out. And these are instruments, they have a great selection, but we do have a limited number, and so you may have something that somebody else needs that's just sitting in your area. So please get only what you need. As far as record keeping, we have to use blue ink, and we want to document all the treatment. And you'll write down the tooth numbers. So if you took out number 10 and 12, you write down 10 and 12. If you took out 10 teeth, don't write 10, wanting us to read your mind knowing that you took out 10 teeth rather than tooth number 10. And you will code it as far as surgical or routine or root tips. You'll also document the anesthesia you give, and the coding is important for those who will be trying to determine the amount of services that we donate. So this is really important as far as record keeping. Prescriptions, we normally have prepackaged antibiotics and analgesics, and if you need to pre-medicate the patient, tell us what antibiotic you gave and what time, and so that way we can know when it's the appropriate time to treat the patient. As you finish your patients, you will again remove the sharps from your tray. You'll take the instruments back to sterilization. If you bring personal instruments, you can do that. Just make sure they're marked with instrument tape and take it to the personal instrument side of sterilization, and they are really great at keeping your instruments separate from the other instruments. You'll use a germicide towelette to wipe down your area, and you'll also run a peroxide solution through the suction between each patient. As far as things to bring, you really don't need to bring anything except yourself. We have good lights, But if you prefer to bring a headlight, you're welcome to bring your own headlight. If you have favorite forceps that you'd like to bring, you can bring your favorite forceps. Again, make sure they're marked well. If you have an electric drill, OkMoM has about 5 electric drills, but if you have an electric drill that you'd like to bring, surgical handpiece, that is great also. Each facility has its own specific setup challenges, and many things in our area will not be determined until the day that we're setting up on Thursday prior to the OkMoM on Friday and Saturday. So we ask that you please be patient with us. We'll try to have things work the best that we can for our sections, and we've made changes through the days if things need to be changed also. Runners will be accompanying the patients to the surgical area and into our work areas. We'll use cards. When you need a new patient, you will hold up a green card and a runner will bring a patient to you at that time. As you complete your treatment, you will hold up a red card, and the red card will have summon a runner to come back and escort your patient to their next area if they need another treatment area, or if they need to go to a pharmacy. Most of the time, surgery is the last place because they don't like to clean teeth after we've done extractions. The next card is orange card. If you have a problem with suction goes down or a problem with a handpiece, hold up the orange card, and the lead will probably come check with you and see what needs doing. If it's sometimes just cleaning out the suction, and we can handle that. But if we'll have equipment techs on hand to help us with any major instrument or any technical problem. If you have a medical emergency, we have a Red Cross. But probably ask, send somebody for us instead of just holding up your hand. If you have somebody crumping on you, don't just go, okay, we need an EMT here. Usually the EMSA, the EMTs are located close to surgery. If you need a translator, hold up the yellow card, and the runners will go get a translator to help translate either instructions or asking what their problems are, or if you need something about their health history, the translators will help out with that. Thank you again for participating in OkMoM.